practices, not only in athletes, but of course in geriatrics as well. And one technique I'd like to discuss with this is its effect on arthritic knees. Now, in the past, there haven't been all that many alternatives for people with severe arthritis of the knees. As you all know, it can occur very early in the 40s, even earlier than that, and can be very disabling. In the past, in order to explore a knee or to remove loose bodies or to do surgery on cartilages or menisci, one had to make a large incision. This oftentimes meant months of relative incapacitation using crutches. The arthroscope is a tool no larger than a pen, and with it we can do quite a number of things. It's put in through a very small incision, and with additional instrumentation which we now have available, we can shave joint surfaces, remove torn pieces of cartilage, remove loose bodies. All this can be a very early way of treating arthritis if this is in an early stage. We also can use the arthroscope to document the extent of injury and plan further surgery, such as a total knee replacement. Total knee replacements, by the way, generally are not as successful as total hip replacements. I'm personally a little more loath to recommend them. But certainly as the years and techniques go by, I'm sure we'll have increasing ways of performing knee replacements that can be satisfactory. We have a question here regarding where do you go when you need surgery? Well, I think surgery can be important, but it's also equally informative to discuss with your physician about non-surgical means, and certainly medicines such as Clinaril, Nalfon. All these are newer anti-arthritic medicines which can be used. As far as the treatment of arthritis goes, regarding the knee, I would say that arthroscopy certainly is a valuable tool, and of course the total knee replacement is also a consideration.
Thank you very much, David. I have a question here from a 73-year-old person who has a complaint of continuous pain in the lower part of her abdomen, and she wants to know, is this her colon and what should be done about this? Well, first of all, the body sends us messages from various systems, and it's up to the physician to find out exactly where this may be coming from. Pain in the lower part of the abdomen could come from several sites. It could come from the genitourinary system or the kidneys or the uterus in the female patient. It could come from the colon. It could come from some muscles. It could come from a hernia. Could come from the blood vessels not getting enough circulation, or could come from arthritis. So the point here is, the first thing before deciding what should be done, I would recommend that it be evaluated fully by your personal physician. I think Dr. Jennerich has a question now that he would like to deal with.
The one question deals with new treatments for a, quote, slip disc, unquote, without surgery. Let me say that my personal experience with this type of care is minimal. Most of the studies done with enzyme dissolution of disc material without surgery has been done in Canada. And although they're advocating excellent results with this relatively non-invasive procedure, I think it's important to recognize at this point in time that it's purely in a sort of clinical experimental stage at this point. Patients are selected with very strict criteria, and it's not a procedure that I myself would recommend for patients that I'd be treating, simply because there are not enough studies in the medical literature to support its efficacy. Basically, what's done is an enzyme called chymotrypsin or chymopapane is injected into the disc, and this enzyme will dissolve some of the disc material. The second question I have here relates to a 73-year-old individual who became mentally impaired after 2 brain CAT scans and 2 EEGs. Apparently the brain cells are dead. What can be done for this gentleman? First of all, there's nothing that I'm aware of in the medical literature that suggests that the relatively non-invasive studies of EEGs and CAT scans will produce brain damage. Indeed, it's a non-invasive evaluation of the brain, and because it's non-invasive, the morbidity or the chances of something harmful occurring after this particular examination are minimal. So I'm not exactly sure what may be going on with this 73-year-old woman, if indeed there was a decrease in mental function after these studies were performed. Now, what can be done for her mentation after these studies? Well, as I said initially in my brief introductory comments, what we try to do is take advantage of what factors are contributing to a given impairment. In this case, the impairment is the mentation of the individual. If the mentation is due to brain damage itself, there are little reversible factors, in fact none in this particular case, that can be taken advantage of to try and improve upon the situation. The brain cells are highly specialized cells. They have lost, for the most part, their ability to repair effectively, and they're specialized in performing the function that they were designed for. Thank you.
Let me just follow up on that question regarding the other treatments for herniated disc or disc disease. The chimopapain is very interesting because it has been propounded by very reliable people, and it does entail somewhat of a risk as opposed to what people have commonly thought. The enzyme is injected into the disc, and the theory was that the disc would dissolve, relieving the pressure on the nerve. Unfortunately, there was a high degree of allergic reactions to it, and especially in the southwest United States, where papaya is commonly ingested. Many people had severe allergic reactions, even deaths, after the injection of the chimopapain. Also, in what we call double-blind studies, saline was injected in a certain number of patients and found out to have equal results, and for that reason, the FDA has not yet approved chimopapain and possibly may not. Let me just say that unfortunately a lot of bad press has been given to back surgery, to laminectomies as they're called, disc excisions, but there are a lot of new ways, new techniques which have greatly decreased its morbidity. For instance, myelograms, which were done in the past, have received an undue amount of attention for the possible damage that they can cause. There's a newer dye out called Amapaque right now, which is a water-soluble myelogram. And what it allows us to do is inject this through a very small needle into your spinal canal, allows us to take x-rays to visualize a disc, and the dye is absorbed by the body as opposed to being taken out, as was the case in the older technique. Also, it's put in through a much smaller needle, and as a result, the incidence of spinal headaches is much less. Many patients with Amapaque, regardless, is no more painful as if you were to have a simple intravenous injection. The last thing regarding laminectomy, which is the technical term for the removal of discs, what we do now is use specialized techniques to make the operation as least painful as possible. We have special frames which reduce the blood loss. We use magnifying loops which enable us to see a disc through a much smaller incision. And we use specially fiber optic headlamps which allow us to once again remove a disc with a great deal of more clarity. It's a very successful operation done in the right patients. The reason that there have been problems in the past that many of them have been done unnecessarily. If you are considering having any spine surgery done, I would certainly recommend a second opinion in this regard.
Thank you very much, David, for your information. I have two questions here that I feel are very interesting. One is from a patient that asked about having taken Metamucil for 6 months for constipation. Is there anything else that the patient can take? Well, first of all, let me answer that by saying yes. But before I get into that, I'd like to emphasize again that constipation is only a symptom. And in any age group, and especially in the elderly age group, it should be evaluated to see what exactly is causing the constipation. It could be underlying thyroid disease, it could be from over-medication, it could be from a malignancy or a tumor. And all of these are important reasons to have this problem investigated and not simply blame it on, quote, old age. Once you get beyond that point, then there are things that can be done for this. Metamucil, of course, is an excellent drug. It's one of the bulk agents that adds bulk to the stool and thereby allows the gut to work in a more usual fashion. There are also drugs that are stimulants to the gut, such as milk of magnesia and medications similar to that. There are stool softeners, such as Colace, that are also helpful, and all of these can be taken concurrently, but again, I would emphasize take as little as absolutely necessary, and please get it investigated first. The other question that I have here, a patient has pain in the legs and in the back and is taking over-the-counter drugs, Anacin, 3 tablets. She doesn't say how frequently. Well, first of all, for pain or arthritis, joint pains and aches, Anacin is an excellent drug. It contains aspirin, which for the most part is the active agent in Anacin, and at this dosage level should be acceptable for most people. However, again, I have to emphasize we have to be careful to watch out for side effects of the drugs because, again, as we mentioned earlier, in the elderly age group, there is a higher incidence of side effects from drugs. And secondly, again, please have it evaluated as to what is causing the pain that one is having. Is it from over-medication? Is it from having potassium being too low? Is it truly arthritis? Or is it something that's masking itself and mimicking arthritis? So all of these things should be evaluated. Dr. Weiner, I think you have some interesting questions here that might want to deal with.
One of the questions I've been asked is, can you remotivate people in a nursing home? Of course you can. There are many, many things. As we stated a few minutes ago, you're probably better off to stay in your own home. When they're in an institution, there are various things which the nursing personnel and the personnel in the nursing home can do. Number one, their attitude. Number two, their care. Decubital ulcers have been talked about. In many of the nursing homes, by working and taking tender, loving care of these patients and the people working with them, they're able to stimulate them both physically and mentally to move and therefore avoid the decubiti. One of the things that we can do is have frequent visits by the family. It doesn't always have to be the same person, but you have to take turns and perhaps take the elderly person out on a visit to your home or to a restaurant or someplace else. And some of the things that we can do is try to help these people with their hearing, give them a hearing aid, give them a pair of glasses that they can see better. One of the things that we do is to have both recreational and occupational therapy. These things are, when given by the person who is in favor or trying to help the elderly, both in their attitude as well as their job, can be tremendous in helping the people to have a new motivation on life. One of the other questions, which is along the same line, is elderly people who live alone tend not to eat. And this is so true. Perhaps one of the things that the elderly can do to help themselves is to visit their neighbors, visit their family, even if it's only in the same home, or you younger people can invite them into your home or for a meal. Or the older people can get together with their own group and take turns. This is a tremendous boost in their nutrition as well as in their appetite. Another question here is, could the stooped over person be due to calcium? Yes, it could be due to that. It could be due to a lot of other things. I have one more question. What is a bleeding ulcer, and what causes it, and can it be cured? In the older people, we're dealing with a different disease than we are with younger people. Most of the time, we can cope with it and frequently cure it through our medicines. One of the new drugs has been Tagamet, although which supposedly cuts down the acid and therefore helps to heal the ulcer. Other older drugs which are still not out of mode and still excellent are such things as Donatol and the belladonna group, as well as the antacids, as well as a diet. Perhaps I did not answer the cause. The cause can be numerous. Fright, a stress ulcer, various illnesses can produce it, various deficiencies, various drugs. There are numerous causes of ulcers. In most cases, we can cope with it, although the older age group are usually more hidden and more difficult to diagnose.
Thank you very much, Dr. Weiner. I know Dr. Cooper has some questions here now that I'd like to refer to him.
Okay, thank you. We have a number of questions concerning numbness, tingling, especially in the hand and fingers, and this is one thing I really would like to stress. Many times people are told, especially elderly people, that they have bad circulation and that nothing can be done about it. Well, this is uncommon. There's certainly a change in circulation as you get older, but in many times the numbness and tingling, especially in the hands, is due to a particular type of nerve compression syndrome called a carpal tunnel syndrome. And it's the alert family physician or nursing personnel that can pick this up, because this has a very good prognosis. I'm not talking about total numbness in all fingers or in all hands, but specifically to people that complain of numbness perhaps in the thumb, the index, and the long finger. Many times half of the ring finger is involved, but almost in all cases the fifth finger, the small finger, is not involved. This can be diagnosed clinically, and also it can be diagnosed by a test called an EMG, electromyogram, which is a very simple test, a test that's oftentimes done by neurologists or at Geisinger by Dr. Janarich. This test involves putting very small needles into muscles to diagnose exactly what nerves are involved. This condition can be characterized by severe night pain, and most commonly people finally relent and have something done when they can't sleep through the night. It seems people can put up with a great deal of discomfort through the day, but come 2 or 3 a.m. when they have to get up because of pain in the forearm, shake the hand, dip it in warm water. That seems to be the last straw, and that seems to indicate to the patient that something has to be done. The carpal tunnel syndrome can be treated with conservative therapies such as splinting or occasional cortisone injections, but the surgery is very successful. Properly diagnosed and treated, carpal tunnel syndrome can be treated with surgery, which immobilizes the hand for a very short period of time, and 2 to 3 weeks later, most people are very happy. It's also very gratifying because that annoying night pain that wakes people up is oftentimes gone the first night of surgery, and the patients are extremely happy and very relaxed.
Thank you very much, Dr. Cooper. Dr. Janarich, I think you have 1 or 2 questions there that...
The first question I have here concerns a 74-year-old diabetic who's complaining of pain and discomfort from the hips down. The individual is concerned about what are the factors other than a pinched nerve that may be causing this particular discomfort. From what is provided here, certainly a 74-year-old individual might have degenerative joint disease about the hips that certainly can produce pain in the hips, and it's not uncommon for pain originating in the hip to be referred down the leg and in fact into the knee. Aside from what's commonly referred to as a radiculopathy or pinched nerve at the level of the back, there is a condition called diabetic amyotrophy, which is really an ill-defined condition which involves the peripheral nervous system, and it's thought that if the diabetic condition, or perhaps more specifically, the blood sugar abnormality, is more tightly controlled, that some of the discomfort about the proximal muscles in the legs, more specifically in this case the thigh, might be lessened a bit. I have another question here. Apparently a woman fell and hurt her tailbone and leg and can hardly walk, and she's concerned about what could be causing her inability to walk. Well, the tailbone is a very small bone, referred to in medicine as the coccyx, and if indeed that is broke, and that is all that is broke, and there's nothing significantly going on with the leg, then there should be absolutely no objective reason as to why this individual can't walk. Just a little bit higher, however, in the spine is the sacrum and lumbar spine, and if indeed these areas were compromised, a pinched nerve in that area, which controls many of the muscles in the leg, could be a cause of some weakness in one or both legs, and may be a reason why that individual is having difficulty walking. Here again, the woman mentions that the leg was also hurt. That's really not enough detail to adequately answer the question from a medical standpoint, but there are a number of reasons why an individual who does have an injury to the leg certainly couldn't walk. Thank you.
Thank you. Dr. Weiner, I think you have a question there regarding medications that might be of interest.
I have several questions, all concerning various medications. One, for example, is Aldomet. Does it cause a dry mouth, dry throat, skin reactions? Yes, all can occur, as they can with most any other medication. However, sometimes we get a little confused because such things as dry skin from the winter's cold, or a decrease in their circulation due to varicosities, and numerous other things can change skin reactions in legs. It is also one of the questions that we've had in the past has been, what about medications to help them and quiet them? Sometimes these are overutilized, and too often too many drugs are used in elderly people, keeping them a little bit too sleepy. However, sometimes, from the standpoint of medical personnel, we have to protect these people by giving them some form of quieter or tranquilizer such that they do not hurt themselves. Every medication that we use on older people can have ill side effects, and so all have to be monitored and watched and changed when necessary.
Thank you very much, Dr. Weiner. I have a question here from a 74-year-old male patient, and he asked, is there some sort of appetite suppressant that he could take? Well, at the present time, there are no safe, and I emphasize safe, appetite suppressants. There are some drugs on the market that over-the-counter preparations that contain quantities of caffeine and antihistamines that are being advertised as appetite suppressants. But the question of whether these are of value to the patient or are effective is not well known. Some of the other common drugs that have been used in the past as appetite suppressants, thyroid medication, amphetamines, also had been effective. However, the risks of taking these drugs and the consequences of taking these drugs far outweigh the benefits to the patients. I also have a question here regarding diabetes. What is diabetes? Well, diabetes mellitus is the inability of the body to handle sugar in the bloodstream, or elevated sugar in the bloodstream. It can be caused by either decreased production of insulin from the pancreas, or it could also be due to a decrease in the body's recognition of the insulin that is present. It's a very common disease. Some people estimate that by 1990 or the year 2000, approximately 80% of our population will have some form or some type of diabetes. So it's a very, very common problem. The next question I have here is from a 72-year-old patient that states that their family doctor had died and wanted to know whether a primary medical practice would be a good substitute for the old general practitioner. Would they be...
To save
Rail service.
Bob Nuno, Eyewitness News,
Northeastern Pennsylvania. Coming up on
Eyewitness News for you. The Soviets accused the United States of interfering in Poland. Pope John Paul says Poland is in a state of siege, and John Moran shows you the latest advances in sports surgery. Stay with us.
Get tremendous savings on all better quality coats at Dice Roads Coats.
For New Year's Day.
Came up a bit short, huh?
Yeah, they did. But
That's too bad.
maybe next year.
They're good. That's a good wrestling team.
The Wilkes College Colonels fell short in their bid to win their first Wilkes Open ever, as the New York Athletic Club, with 4 wrestlers in individual winners, took their 6th Wilkes Open. Wilkes lost a couple of matches by just 1 point. Kurt Roulette lost a 9-8 decision to Ed Pigeon of Hofstra after Pigeon scored the win on this takedown just before the match was over. At 145, Lenny Nelson of Wilkes, who won his weight class at last year's Wilkes Open, came back from a 2-point deficit to tie G. Nyman of the New York Athletic Club and send the match into overtime at 1-1. Then Nelson took a 2-point lead in the overtime with this takedown. But Nyman, who was very crafty, tied the match on this escape. Then the former Eastern Wrestling champion scored the victory on this takedown for the 3-2 victory. At 153, Mark Poppel needed this 2-point reversal to tie the match at 4 points all, with Roy Legacy, who was wrestling unattached. Then he took the convincing 8-4 victory with 3 points on this near fall just before the end of the match. The New York Athletic Club then ended up with 62 points to 55.5 for Wilkes College. Bloomsburg finished 3rd with 22 points. The high school basketball tournament at the McGrain tournament, the Wilkes-Barre CYC. 2 overtime battles tonight, which saw Hanover and the Hawks take the tournament 54-52 over GAR. The tournament MVP coming up right here, number 5 on the layup, Steve Harnisberger. He had 17 points, and he is my favorite. Sam Toney of GAR was almost lackadaisical as he hits there for 2 points. Then Harnisberger to Steve Gravel. Gravel had 21 points as he puts it up and in, turns around, up and in, shoots, scores. Then it's Richard Mako. He has the ball stolen by Hanover right here. Then the Hawks bring it down court, as they were apt to do all night, last night and tonight, and whenever they did this McGrain tournament. Guess who ends up with the ball? Harnisberger shoots, scores. You got it. All right, folks, as they win the tournament. Okay, let's go to the scoreboard tonight. 3, 2, 1. As we take a look at the high school scores at some of the tournaments. There's the McGrain tournament. Also tonight, it was Myers beating Bishop Hoban 72-68. That was also an overtime battle. Also other high school scores. We have nothing from the Dallas tournament. Thanks a lot, guys. Okay, let's go on to the next tournament, the Munley tournament. It was Wyoming area losing to Riverside 75-68. Crestwood loses their tournament to Coughlin 78-56. Also tonight at the Lynette tournament, Bishop O'Reilly wins again 70-60 over Scranton Prep. Dunmore 48, Nanticoke 29. Other tournaments, the North Pocono tournament, Bishop Hannum by 38 over Old Forge, and Bishop Klonowski by 11 over host North Pocono. It was Wallen-Paupack beating Honesdale, and Susquehanna takes Hancock of New York. In non-tournament action, Abington Heights beat Lake Gleeman by 1 in overtime. No score for Central Columbia. And Palmerton wins their 10th without a loss, 65-37. Ron Endress was the game's top scorer. And Sacred Heart of Carbondale beats Father Lopez in a tournament in Orlando, Florida. Thanks for that scores, guys. And in college basketball, St. Joseph beats Bucknell 71-58. Well, this one coming up right here. There was a wild one in the National Basketball Association tonight. The New York Knicks, in overtime, beat the Cleveland Cavaliers 110-108. It was Cleveland's Phil Lambier's 3-point play that sent this game into overtime with just 2 seconds left. Marv Albert picks up the call.
88, Knicks by 3, 5 seconds remaining. Kenny Carr to inbound. They have no timeouts left. Not the man they want taking the three-pointer, but he's got it! 2 seconds left. We're tied at 101. Bill Laimbeer has tied it.
Good shot, Phil. Too bad it didn't do it for you guys. New York wins anyway, 110-108. Also in the NBA tonight, it was Detroit losing to New Jersey, 130-119. San Diego beats Atlanta, 94-91. Washington loses to Milwaukee, 107-103. Houston in the third period leads San Antonio leads 85. Well, we have a final there. San Antonio, Joe Fox is right on the money as usual, 109-104. And Kansas City beats Denver 120-116. Also tonight at the half, Boston leads Utah 65-51. Phoenix 55-54 over Portland at the half. And the Philly 76ers in a late start out at the Kingdome. Well, it has changed the treatment of knee surgery dramatically. What it is an arthroscope. And until recently, it was only available in the larger cities. But now, thanks to Dr. David Cooper, the treatment is available right here. It was first described in Japan in 1933. Arthroscope